What happens when you go under the knife in a state where nobody's required to tell you who owns the clinic or whether the medical director is even still alive? I'm Dr. Kate D, founder and medical director of Glow MediSpa. This is MedSpa Confidential, where we expose the risks, the red flags, and the outright illegal practices happening inside med spas right now, because you deserve to know the truth before you book. Today, I sit down with Dr. Alexander Zuriarrain, or Dr. Zuri, a Miami-based plastic surgeon with four board certifications and years of experience as a medical legal expert witness, which means he's reviewed the cases where things went very, very wrong. You'll find out why awake facelifts carry risks most patients never hear about. You'll walk away knowing exactly what separates a bad cosmetic outcome from actual malpractice. And there's one resource for vetting your surgeon that almost nobody thinks to check. Stay until the end, because Dr. Zuri reveals a detail about deceased medical directors that will change how you research any clinic going forward. Dr. Zuri, thanks so much for being on the podcast today.
Thank you, Dr. D. Very much appreciate you having me on. This is great. Thank you.
Well, we've had some great conversations so far. So I really want to start with your four different board certifications and talk about that, because that's super unusual. So you have board certifications from the American Board of Surgery and the American Board of Plastic Surgery. Okay, those two are basic for any plastic surgeon. But then also the American Board of Cosmetic Surgery and the American Board of Facial Cosmetic Surgery. So having those four is pretty unusual. Can you tell us what they all mean and what that entailed to get that?
Yeah, it's extremely controversial, the world of cosmetic surgery versus plastic surgery. It feels like these two camps are kind of battling out the world of what we would call in the plastic surgery world, aesthetic plastic surgery, and what other camp would call cosmetic surgery. So to get to where I am today, I basically went through a 5-year general surgery residency program. And then I got my board certification by the American Board of Surgery. And then I went on to the Cleveland Clinic, and I spent 3 years becoming a plastic and reconstructive surgeon. At that point, I decided that I was interested in more of the world of cosmetic surgery, and I wanted to kind of hone in on that. So I did an additional 1 year of training through what's called the American Board of Cosmetic Surgery. And I spent a year basically doing facial cosmetic surgery and body cosmetic surgery. And then I took that additional board. There are a couple of avenues to get into the cosmetic surgery world. You don't have to actually be a board certified plastic surgeon to enter into the world of cosmetic surgery. You can go as an OBGYN, a gynecologist. You can go in as an orthopedic surgeon, ENT, ear, nose, and throat surgeon. So they accept different surgical subspecialties to do this 1 year training program, fellowship program to become a cosmetic surgeon. It's super controversial because the plastic surgeons will say, hey, why do you need to do another year of cosmetic surgery? Because we basically taught you everything you needed to know about being an aesthetic or cosmetic plastic surgeon in your plastic surgery residency program. But some of us feel like we want more additional training. And what's different about the cosmetic surgery training is that you actually can get a board certification in cosmetic surgery. Whereas if you do an extra year as a plastic surgeon under a plastic surgery aesthetic fellowship, you don't get an additional board certification.
Do they study the same things or, Yeah.
They pretty much do, but I would say my biggest argument, and we'll get into this later on about me being an expert witness and about me dealing with medical legal cases for both the cosmetic surgeons and the plastic surgeons, and the eternal battle between the two, where the plastic surgeon says, well, the cosmetic surgeon is unworthy. They're not as studied, or they haven't spent enough time.
Well, in all fairness, most people who do that fellowship are not they're not surgeons, they could be an OB-GYN, but they will take, family medicine or other subspecialties, right?
No,
Okay.
They won't. No,
okay.
They won't. No.
Okay. So because most people who call themselves a cosmetic surgeon didn't go through plastic surgery, correct?
No, they did not. They did not.
Yeah, but you're both.
I'm both. I'm both because I felt that I had an opportunity to be both, right?
Yeah.
And I also didn't want my patients, when they came for a consultation with me, I didn't want them to think that there was somebody else out there that somehow knew more than I did about what I do. I wanted to be
Right.
at the Mount Everest, at the peak
Yeah.
of my specialty.
Yeah. So just for anyone, our audience, one of the key things is if you're having someone operate on your face, then you want somebody who has extraordinary experience operating on the face, which would be like a plastic surgeon or a ENT with, facial plastic surgery fellowship, right? But then there's the rest of your body. And you, having done like, gazillion years of surgery, including general surgery, you've operated all over the body. And so for you to do now cosmetic body procedures is a logical extension, right? There are some people who actually, so I'm not saying that fellowship, but there are ones where it's a 1 year fellowship where you have not been a surgeon and they will take family medicine people and all kinds of other people who have not been trained in surgery. So it is a very big difference between somebody who calls themselves a cosmetic surgeon who literally has only 1 year of experience in surgery and training versus someone like you who's got, as far as I can tell, it's something like 13 years. I was trying to add it up in my head. Yeah.
Right. Right.
So that's a big difference, right? I
Yeah,
think
yeah. It's a big difference to do just 1 year of cosmetic surgery. I don't deny that. What I would argue is that when we become plastic surgeons, we spend so much time doing reconstructive surgery that we don't actually spend more than about a year of our time in total with aesthetic surgery. So I do believe, in my opinion, that even if you're a plastic surgeon, that you should seek additional time in training in cosmetic or aesthetic plastic surgery. You got to do some more time because, in my opinion, if you're just a general surgeon and just a plastic reconstructive surgeon without any other exposure to more nuanced aesthetic or cosmetic techniques, I think you're at a disadvantage.
Yeah, that's very interesting because so also for our audience who might not completely know, right? So reconstructive is when plastic surgeons go and they reconstruct a chunk of your body or your face or whatever that's been injured either because you had to have surgery and remove a big cancer or you had trauma and something got ripped off or, just to be really grotesque about it. And so it's a really kind of creative way of reconstructing body parts out of other body parts to make you look basically, aesthetically normal, right? Super different from doing cosmetic things like facelifts and other stuff to make people look, more beautiful or younger or less wrinkly. I just think it's really, really interesting. So let's talk. Can we talk a little bit about facelifts? So I have talked to another plastic surgeon about this a little bit, and I'm really curious to know your stance on it. So you perform true deep plane facelifts, right? That are clearly that's a term that gets debated and interpreted in different ways. And so as a medical legal expert and an expert witness, so you've likely seen cases that were related to misrepresentation that might have caused actual real harm. So how often does the technique misrepresentation show up in the cases you've been called to review and what does it actually look like legally and medically? There's no reliable way to know if a med spa is following safety standards or cutting corners. Until now, the Med Spa Board certifies clinics that prove they're doing things right, verified products, licensed staff, and actual medical oversight. It's the difference between rolling the dice with your health and knowing exactly who's holding the needle. If you're looking for aesthetic treatments, go to medspaboard.com to find certified med spas near you. And if you already have a med spa you love and they're not certified, please send them our link. If you're a med spa owner doing things right, get certified and show your patients you're not cutting corners. As a bonus, certified spas also save a ton on malpractice insurance. Do the right thing and go to medspaboard.com. Keep listening, keep asking questions, and stay safe out there.
Yeah, I think the most important aspect in my medical legal reviews of facelift cases is really when they're done under sedation or what we call awake facelifts.
Mm-hmm.
That unfortunately draws the idea of an awake facelift, draws a very large crowd of patients that are terrified of having any general anesthesia, right?
Mm-hmm.
Unfortunately, what I see a lot of times is facial plastic surgeons, facial cosmetic surgeons, anybody doing facelifts, that if they try to market themselves as an awake facial plastic surgeon or facelifts, they do it almost, in my opinion, sometimes it can end up being more like a marketing scheme. And what ends up happening is that when you look at the cases, of the complications related to facelift surgery, by far, the ones that have the most complications are the ones that are done awake. And the complications can be lethal, deadly complications due to the titration and basically the manner in which the anesthesia is given. When you're doing sedation, you have to be extraordinarily careful. If you go a little bit beyond the dose that the patient requires to stay in that very gray limbo of being asleep and not being awake, if you go too far, the patient will stop breathing and it becomes an immediate airway emergency.
Right, right. So by awake, it really means you're just not under general. So you're still getting very heavy sedation, but you're not intubated, meaning there's not a tube down your throat. So, but what Dr. Zuri's saying here, okay, is that God forbid you get a little too much and you're not breathing. Now all of a sudden there's an emergency and they've got to stick that tube down. I know that when I was in residency, that was very much an issue with people getting sedation for MRI, and they would be in the scanner and you couldn't monitor them at all. So that was like super dangerous. I'm dating myself because I don't think this would ever happen now. But it used to be that, that this was a little less regulated. So now is that you have to be very, very careful about monitoring. Otherwise people can't be sedated for things like that. So, but you're not talking about being awake, like completely aware of what's going on just with like a local anesthetic.
No, it's typically not awake. But what ends up happening is that in order for it to make it comfortable, even under like a light sedation, they have to inject enough local anesthesia. They have to inject enough lidocaine, either through tumescent infiltration, which is like mixture of liquid with anesthesia, to make it tolerable. And so that has a compounding effect as well throughout a 3 to 4 hour operation. You keep giving more lidocaine. The patient keeps complaining, keeps groaning, keeps making noise. You think they have pain, and then they end up in a lidocaine toxicity, which then causes an immediate arrhythmia or death on the table because it's very difficult to reverse.
Right. So that's like a couple different ways you can die, which sounds terrible to me. What are your thoughts on this? I had a patient call, really because of this podcast, and she had gone to someone who kind of wasn't working in a real office, and they offered her awake facelift, but with local only, like no sedation at all. And she called me kind of freaked out because for her, it was a 4-hour surgery that she felt like was torture because her face was being peeled off and she was completely aware of everything. Have you ever seen a medical legal case like that? And like, what are your thoughts on that?
No, I haven't seen just a strict local case. I would be even more worried for that patient because if they're not getting any IV sedation, if they're not getting anything extra, just the lidocaine to do that, I don't know how people tolerate things. But, it's impressive how patients will tolerate procedures under local just because of their deep fear, their deep seated anxiety related to general anesthesia. And what I found, I have an undergraduate in psychology, and I found that a lot of these patients, they don't want to let go. The feeling of giving up control to another human being to them is just not acceptable. So they're willing to undergo, their face being peeled off under local to avoid that.
Well, I think this person was going for price. I mean, she told me, it was a very, very, very extraordinarily reasonable price. And of course, anesthesia costs money. And this person didn't have really a established practice. The ENT who did the surgery had gotten in trouble in another state, moved to my state, and then had trouble getting establish, privileges anywhere. So she was offering, cheap facelifts this was in a room in a med spa. And, and she was apparently so aware that she just knew, like heard everything going on, people coming in and out of the room. And she called me just to find like, Dr. D, is this normal? And I'm like, no, it's not normal. Oh my God. Well, so as an expert witness, you've reviewed all these cases from the inside and the records and the photos and the op notes. What are the most common failures you do see when plastic surgery goes badly enough to end up in litigation? Is it usually about technique or informed consent or patient selection or something else?
Yeah, so I would say a lot of times it is patient selection. I think that is one of the biggest issues. And I think that that's where your experience as both a general surgeon, plastic surgeon, cosmetic surgeon, I think that's where years of experience really comes into patient selection. I think that you have to see that in your residency or your fellowship over time. If you go out into practice with very little experience, you're going to start to select the wrong patients for surgery. You're going to perform the wrong surgery on the wrong type of patient. And then once that downhill occurs, it's very difficult to come back from that, because surgery is a specialty where once you make an incision, there's no way to go back. It's very difficult to really completely correct the problem once it's occurred. So I would say patient selection is very, very important.
Can you give an example, like, so people can understand, like, what's an example of that?
Oh, those are tons of those. So easy example, patient comes in, she's had 3 children, she has extra skin to her lower abdomen, she's adamant about liposuction. Dr. Z, I want you to do liposuction because I think that I've looked at this on TikTok. I've seen it on Instagram. Lipo is what I need. That's what I need. I've seen before and afters of other women that look like me, and I need lipo. And so an inexperienced surgeon would potentially think that lipo is going to be a good idea on this woman. And it ends up being a catastrophe. She ends up with fibrosis, more skin laxity than she started with, an irregular contoured abdomen, and she's distraught, and then she sues the doctor. Right?
In that case, that person really needed a abdominoplasty, and they just didn't offer it.
That's right. Right. They didn't get offered the right procedure, or they did get offered it. The patient denied it, and then the surgeon still agreed to do something that he knew wasn't going to be the right surgery just because the patient,
wanted it. I think that's a trap that anyone in cosmetics, like someone comes in absolutely sure they want something, they want you to do it. And if you try to talk them out of it, sometimes they get mad. What are the most egregious cases you've seen where something went awry?
I've seen death cases from facelift surgery. And not too long ago, I reviewed a case of a death regarding awake, sedation facelift. Mm-hmm. And I've seen interesting cases of, patients that it's a known complication, but patients will have nipple necrosis. Like, let's say we do a breast lift, and their entire areola and nipple will die. It's a very rare complication, but it does occur. It does happen. And I think that that's where, patients also need to realize, and they need to understand that every surgery, every intervention, every procedure does have its inherent risk and inherent complications. And they need to know about these things.
Is that partly a technique thing? Are you able to know for sure that you're not going to sacrifice the blood supply to the nipple, or it's...
For the most part, you do. But again, depending on the patient, the anatomic characteristics of the patient, the quality of the breast tissue, their age, their weight loss history, the length from their neck to their nipple, right? These are sometimes cases where you can follow the textbook, you can follow the standard in terms of what another reasonable surgeon would do with the same training in the same situation where most of us would encounter. But even then, sometimes it's difficult to avoid 100%. And I think patients don't do a great job most of the time of asking the difficult questions and reading the consent. They don't read the consents.
Well, shouldn't it be explained verbally by the surgeon? Like, these are all the possible bad things that can go wrong. Usually you should mention the big things like that. I mean, it's kind of like omitting the possibility of vascular occlusion with dermal filler. It's not a likely scenario, but it's possible and it can happen to anyone. So
It can. It can.
we always mention that. That's really important. Always mention that out loud.
For sure. Now, the problem is that if you look at the American Society of Plastic Surgeons consent for an abdominoplasty, right, it becomes unreasonable and nearly, I would say, nearly impossible to consent a patient on all of the potential situations, all the potential risks that could occur. So the patient has to be their own advocate also. They have to read the consent. We are going to facilitate the most common situations, the most common complications, maybe the top 5, but we cannot spend 2 hours just talking about a consent.
Right.
It's not realistic. It's not possible. It doesn't happen. I've been in surgery my whole life. I've consented thousands of patients in residency, fellowship, and in practice, and nobody has the time to spend going over every page of a consent process. So you do have to be your own advocate. And if, your audience, my audience, everybody that listens to our podcast, you have the right to ask for your consent. You can ask for a copy of your consent and you can read it. And that's your prerogative.
Do you ever give people the consent form ahead of time so they can read it before they're just like ready to go and on the table,
100%. 100%.
That's really important.
Yeah.
I mean, I think nowadays, if you get it electronically, you can just feed it through Claude, and Claude can tell you what the big things are on there. They are long forms. I mean, I do that now with every legal document I have to sign. I'm like, Claude, tell me what I need to look out for on this thing.
Oh, yeah. It's scary.
I think a lot of times patients don't realize that there's a legal difference between a bad cosmetic outcome and actual malpractice. So where does that line typically fall? Do you see a lot of cases that are really just bad outcomes rather than malpractice? And what separates a surgeon who had a complication from one who is genuinely negligent?
Yeah, I would say the vast majority of what we see are bad outcomes, but not a technical error per se, not an egregious intervention, that led to this horrible outcome. It's really, a lot of what I see is really in the consent. It's in the consent. It may not be the top 5 most common complications, possibly, but it's in the consent. And for the most part, what we see are just very disgruntled, very upset patients, unhappy because of their outcomes. And then they turn that anger, they divert that anger into litigation, which we all know in medicine and in surgery, most of these cases, they're going to settle. They're going to settle. 80%, 90% of these cases settle. They don't really get to anywhere. It's a horrible process. It's a horrible process for the surgeon. It's a horrible process for the patient. The only ones that win are the attorneys on both sides. They're the only ones that win. And so it's something that I wish somehow we in this country we could do more about, regarding how litigious our society is in general. Our culture as Americans is extraordinarily litigious. I travel the world. I've been in many different congresses. I've been in many different meetings in Brazil, in South America, in Mexico, in Europe, in France, in Italy. The surgeons don't suffer from what we suffer from here when they have a bad outcome, that it automatically, the first thing that comes to a lot of patients' minds is, I'm going to sue this doctor and I'm going to try to figure out how I can get money.
Medical legal issues since med school. I don't really understand why, other than my dad was a lawyer. Maybe that's why I got into this. But I think that the biggest thing that people don't understand is, like, a bad outcome can happen no matter what. Like, that's even in the best of hands, even with the best technique and the best conditions, there can be a bad outcome that's not anybody's fault, right? And that's supposed to be explained in the consent so people understand, okay, I know I'm taking a risk here. So in in traditional medicine, I'm going to say traditional meaning not elective cosmetic surgery, most of what we had to do was to save people's lives or, to treat disease. And it was pretty straightforward. Like if you didn't do the thing, person might die or, be very, very sick. And so there are three components to malpractice, right? It's not about bad outcomes, right? It's about negligence. The doctor did something wrong. It's about harm, like you actually have to be harmed. So temporary thing that goes away, that, is not really any permanent harm. So kind of like that about Botox, can't really harm people with Botox. But then also it's not meeting the standard of care, right? So you did something that was weird. You did some unorthodox thing. You did some non-FDA approved thing. You did something that just wasn't right. Nobody else would do that thing, or very few people would do it. And that led to the harm, right? And that's malpractice, right? That's a real case. And I think that the vast majority of times, the cases that get brought are not the actual malpractice cases. The cases that get brought are when the communication broke down, someone's super unhappy about how something was handled. It might not even be the doctor. It could be, the hospital where this happened, or, some other weird factor that went into it, or the communication between the office and the patient. And unfortunately, our country doesn't really differentiate. Our legal system doesn't differentiate. Like a case is a case. It makes you miserable, takes a couple years of your life away. And it does that for the patient too, really, because nobody likes having litigation that's pending. Like it's very, very, expensive. So I'm kind of curious, like what brought you into doing medical legal work in the first place? I mean, I know why I'm kind of curious, just because my brain likes thinking about it. But how'd you get into doing that kind of work?
I always, I was in medical school. I'll never forget. I was in my third year of medical school, and I called my father one day and I said, "Hey, what do you think about me getting an MD JD? What do you think about me doing a combined degree?" And my father, I'm never going to forget, my father specifically said to me, he's like, "Why don't you just finish medical school first? How does that sound? Like, why don't you just you don't have to do it to make me proud. I mean, just get through the MD first and then figure it out." This is a person who, he immigrated to the United States from Cuba at the age of 10 years old. He had a very difficult childhood, very difficult upbringing. He sacrificed for me to get to where I am. And I really truly believe he didn't want me to make a mistake. He didn't want me to derail myself from where I really was going to be. To this day, I don't regret it. I'm not going to, say that I regret not getting the JD, but I do believe it would have been extraordinarily helpful. I do believe it would have added another very, very strong dimension to my professional career. Can I do it now? Sure. But I have 2 young children and I have a very busy practice, and I'm not about to take the bar exam at 43 years old. Thank you very much. So that ship has sailed. But hey, if I can't be a JD, at least I can use my knowledge, my board certifications, my experience to at least give back to this world that I really enjoy. I enjoy the world of figuring out the truth, getting to the truth of what really happened. And the truth never lies. And I want to help get to justice. And justice for me is extremely important when it comes to these cases. Either justice for the plaintiff, justice for the defendant, justice for the surgeon, justice for the patient. But justice is justice, and it deserves credible expert witnesses that are dedicated to doing the right thing, and that are not either all on the plaintiff side or all on the defendant side. Somebody who really cares and who has the knowledge, who truly has the knowledge for this niche specialty. And I think that that's important. And it's a contribution that I feel that I give to society beyond the beautification of the people that I meet. And that's important to me.
That's so great. That's really inspiring. I have to say that I had a similar phone call with my own father. I was a first-year resident, though, by that time. And I was like, maybe I should go back and get my JD. And my father had a conniption. He's like, oy vey, no, like just do your medicine. but I mean, I am on a different path, but that's why I'm ending up doing this med spa board thing, because I just see it as the right thing to do. And if we can get to the truth and give consumers the truth, then everybody is better off. There'll be fewer bad outcomes. If you had to change one thing about the world of plastic surgery, the way everything functions right now, to make it better and more about the truth, what do you think you would do?
Yeah, that's a very good question. First of all, I think we need to deal with social media. I think it has been extraordinarily destructive to our specialty. I think it has really produced a lot of misconceptions of plastic surgery, of plastic surgeons in general, of before and after, of outcomes. I think that the marketing of plastic surgery has become a huge problem. And I think that if that could get somehow under control, under some sort of regulation, if you look at all of our other specialties, orthopedic surgeons, ENTs, general surgeons, all other specialties, none of them do the kind of marketing that we do. And I put myself in there because for us to be able to be competitive, especially in a market like Miami, for example, where I can throw a rock and I can hit a colleague like down the block, we probably have the most number of plastic surgeons per city, per density by a long shot. Maybe Beverly Hills and Manhattan.
You know where I learned this statistic on one of these podcasts, where it has the highest per capita. What state? It's Utah.
Utah, yes. Utah.
They have a lot of plastic surgeons. Not as many people in Utah.
Yeah, but to that point, I think the marketing is a big problem. And I think that the American Board of Plastic Surgery has tried to kind of control it, but they've been very unsuccessful at doing that.
Well, marketing of anything medical used to be illegal back when I was a kid, right? And that got undone. And I think the big reason why there's marketing in plastic surgery is because it's cash pay. It's the same in the med spa industry. It's cash pay. And so people are paying their own money. They can decide what to do with it instead of, having, their insurance decide or their doctor decide. They're going to decide. And social media is the Wild West. I mean, it's insane. My practice, we really do not post on social media, and we don't put before and afters or anything like that. We have a presence just to, as a business, but there are entirely social media only cosmetic practitioners of all different kinds. They don't necessarily even have any license to do any of that, but they're on Instagram. And the moment they get found out and someone's onto them, they shut one Instagram down and they open up a different one. And So I agree with you. I don't know the answer to that. Like, if we could control social media, the whole world would be in a different place, but that we don't.
The other thing that I think would make a huge difference, and I know it's very state dependent. Every state has its own laws, but in the state of Florida, you don't have a really tight regulation over who can own a plastic surgery clinic, plastic surgery center. In Georgia, the physician has to be 80% owner of the facility. In Florida, the physician or surgeon has zero.
Yeah, there is no. Florida happens to be one of the few states that does not have CPOM laws, so corporate practice of medicine. So anyone can own the business, whether it's plastic surgery or a med spa or any other medical practice. They do have stricter laws about licensure and who can do what. So usually a state will have either both CPOM and strict licensure scope of practice laws. But if they tend to lean on one or the other, they tend to have more lax the other side. So like Texas has very strict CPOM law, but pretty ridiculously lax licensure and scope of practice law. So, So Florida is very strange. It is super duper Wild West because it's kind of upside down compared to other states and how they do things. I mean, just Florida specific then, because that's kind of interesting to me. Like, what's the craziest thing you've seen in your industry in Florida? Like, what should Florida do about it?
Yeah, I think that Florida needs to consider these CPAP laws, like you're mentioning. I think that we really need to consider changing who can own these clinics and who can own these facilities. The craziest thing that I've seen is there'll be a deceased physician who will be the medical director for one of these high volume plastic surgery centers. And or they'll get this retiree. He's like, 75-year-old internal medicine doctor that'll, he'll be medical director and he'll do it for $200 a month. He doesn't care. It's just so extreme in how anybody can just pop up and become a plastic surgery office in Miami and in Florida that it's scary. It's very scary.
Yeah. I guess I'll have to put that on my list of questions patients should ask. Not only is ask who is the medical director, but ask if they're still alive.
It's like absentee ballots, when the elections come around.
So based on everything you've seen, what if you were advising a patient who was looking into plastic surgery, whether or not it's Florida, but let's say they're looking into it, what's the most important thing for them to ask before they decide who to have do surgery on them? Or several things?
It's a great question. Yeah, it's going to be several. It's going to be several for sure, like everything in life. But I think one of the core questions is, where am I going to have my surgery performed? Right? What's the accreditation of that facility? Is it ACA? Is it Quad ASF? Is it one of these nationally recognized agencies? And yeah, who owns this practice? Who's the owner? Who's the medical director? Okay, that can change. We know that could be some old guy in a wheelchair. But who is the actual owner of this facility? Like, is it actually the doctor, or is he farming out plastic surgeons and he's a used car salesman who had a bright idea of having a plastic surgery practice because it's a great business? That's really important. Board certifications, I think, are massively important. I think we all know that. That's pretty. The other thing that I always talk to patients about is what happens if something goes wrong. If it all goes swimmingly well, then it doesn't matter. But if it goes wrong, do they include any complications insurance for your surgery? And we do. We know there are a bunch of surgeons that do it. It's called Cosmetic or Sedation. And they cover you the first 6 weeks. If you have a complication, they'll help pay for that complication. Hospitalization, infections, hematomas. You have some sort of backing. So as a consumer, as a patient, when you go to a practice and they're all about patient safety, but they're not accredited by a national organization, they don't offer you any type of insurance after your surgery if you have a complication, because otherwise you're out of pocket for that 100%. Are they really putting, the owner is not a surgeon, are they really putting their money where their mouth is when they say patient safety is they're all about patient safety on their marketing and on their website? I would argue that they're not. And that you need to dig deeper and figure that out. The reviews are wonderful. I think reviews are great. The volume of reviews are very important. The different platforms of reviews, if they have 300 on Google and they have nothing anywhere else, that's concerning. Okay. And also, the Better Business Bureau. I think the Better Business Bureau is a very untapped resource. I think that if you're going to have surgery at a practice and they're not accredited by the Better Business Bureau, or they have less than an A+, I wouldn't have surgery there, personally, because people will complain to the Better Business Bureau if they had a very bad experience, either through their payment process, a refund that they never got, or the internal processes of the business. And there you're going to learn a lot about who really owns it and what their internal systems are. And that, to me, is a huge red flag.
Yeah, well, that's actually a really interesting part of it I didn't even think about, right? Is when you have a elective cosmetic surgery that you're buying, right? You also have to pay for the aftermath if there is any. And that could be extensive. That could be very, very pricey. And so do any plastic surgeons offer, like, I don't know, a fix for free, or is that always just cost more?
No, that's always going to cost more, because typically what ends up happening for most plastic surgeons is that the price that they give to have the surgery, for the most part, in general, is pretty much like the most competitive price for their market, right? So if you have surgery in Manhattan, if you have a facelift in Manhattan, you can run a facelift into $80,000 or $100,000 for a facelift in Manhattan.
Yeah. And I've heard prices like that around here too in Seattle.
Yeah. And in Seattle as well. Possibly. But in Miami, you're not going to see that price. If in Miami you see a facelift for 50 or 60, they're already like stretching like to the max. All right. So what ends up happening is that if something happens, there's going to be less flexibility to do things for free. Now, things are done for free typically if it's under local anesthesia, if it's a small correction, like a little dog ear, like a little puckering, like a little thingy, then most of us would do it for free. But if we're talking about, oh, I didn't like my implant size, and 6 months later, I felt they should have been bigger, but then no, we're not going to go and do an entire breast augmentation for free.
Right, right. Yes, that would be crazy.
And that's where patients can get very unreasonable in their approach with the surgeon because they think because they paid, I don't know, 30,000 or 40,000 for a facelift, that means that if they have a little bit of extra skin that was left here in the corner, that they're going to get a whole neck lift for free. Like it doesn't jive.
Well, you must have kind of pretty thorough conversations with people to set their expectations before this, right?
You do. But we know in psychiatry and in medicine that there are people that have, oppositional defiance. There's people that have body dysmorphia. There's people that have, very unrealistic expectations, even when you lay it out. And I'm very blunt. If you read the reviews about me online, I'm extraordinarily blunt and I'm extraordinarily transparent, for better or for worse, because I don't want to get into these situations in the post-operative visit where they thought they were going to look like somebody else.
Yeah. So. Well, I'm with you on that, on the bluntness thing. I'm very willing to tell people stuff they don't want to hear. I'll just talk them out a bit. Also, if I just think this person's never going to be happy with anybody doing anything to them, I won't even touch people, because there are a lot of people like that. Do you have a screening, like a psych screening or anything that you do for patients coming in your door? Yeah.
Definitely. I had a patient today. She's a beautiful Australian woman, 20s, excellent like proportions. I mean, just a very, 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 very beautiful person, physically and personality as well. And, I had to tell her, I said, listen, she wanted to do more for her abdomen. She wanted to do a reverse abdominoplasty. And I do that operation and I really like the operation. But I said, you don't need that operation. Like, you don't need that. Like, that's not.
Yeah. Sometimes it's hard to tell someone that they're beautiful and they don't need anything. They don't even hear that.
And then they'll go up to another surgeon across the street or in another place, and they'll get their reverse abdominoplasty done. They'll do it. They'll get it done.
Yeah.
Because what I have found in my experience over the last 10 years is that when a patient has something that they want done and they really believe that they need it done, they will find a surgeon who will do it for them.
Yeah. Unfortunately, I think that is very true. And that's true kind of everything. Well, Dr. Zuri, it's been fabulous talking to you. It's so interesting. Is there anything you want to leave our audience with before we part? And also let people know how they can reach you in Miami. I think that'd be great.
For parting words, I would say that your family is the most important asset that you have when it comes to plastic surgery. So always think about the importance of involving your family in the decision making. I take that very seriously when it comes to patients coming in my practice. I'm very open to having the husband, the daughter, the sister, the brother. I think that that's very important. Don't make isolated decisions when it comes to having these procedures, because you will need somebody to depend on after the operation. You will need somebody to help you in the post-operative recovery. So I get very nervous when a patient comes in all by themselves. They've made this decision all by themselves. They have no support system. And they're asking me if they can drive themselves home after the surgery because they have no one. They don't have a friend. They don't have a family member. So, we talked a lot about consents and about picking the right surgeon and about the credentials of the surgeon. But you also need to be, as a patient, you need to be prepared for what you're gonna have done. You can find me in South Miami, Florida, Zuri Plastic Surgery. is the practice, and ZuriPlasticSurgery.com. That has everything you would ever want to know about everything that I do.
We'll have links to all that in the show notes, so you can just check there too. Well, so Dr. Zuri, it's been a pleasure. Thanks so much for being with me today.
Thank you, Dr. D. Appreciate your time.
Thanks for listening. If this episode opened your eyes to something you didn't know before, share it with someone who needs to hear it. Subscribe so you don't miss the next one. And drop a comment telling me your biggest takeaway. I actually read them all. Join me on this mission to keep you safe and push this industry to do better.